Round. We just might get there. Senator Campbell.
Thank you very much, and thank you for coming today, Doctor. Do you happen to be familiar with a group called Smart Approaches to Marijuana?
Yes, I'm familiar with them.
Are you a member of them?
I am not.
It surprises me because your stats virtually mirror everything that they say, and quite frankly, I'd like to just address two of them. So hospitalization in ER, there's this great surprise on your part that when marijuana is legalized, suddenly people start showing up in the ER. I mean, I would suggest to you that the reason they're able to show up in the ER is because when they have difficulties with marijuana being legal, they can actually go get medical support for, as you point out, mainly, it's probably mainly psychotic episodes that they find. And so it should come as no surprise. Everybody's making a big deal about this, but it should come as no surprise to us that when you legalize, people are going to take advantage of the medical facilities that are available rather than taking a chance on having their children taken away from them, being arrested, the cops being called. Would you agree with that?
I would. I mean, that's part of the social norming. When
Right.
people, when a substance becomes more available and readily accessible, and people find that it is safe or reportedly safe, herbal, green, or whatever descriptor you have, and with increased use, with legalization comes increased use. With increased use comes increased problems. With increased problems comes visits to the emergency department.
The SAM report was 2013, which basically started this whole thing, but in 2017, and there's a report that's coming to all senators, there's a Colorado report that suggests that some of the public health initiatives with regards to cannabis-related harms are actually positive and are actually moving forward. The second thing that I want to address, and again, your stats, it's the same type of thing from Sam, is this opioid use and overdose. Surely you're aware that there's an epidemic of overdoses around the world. And it doesn't matter whether you have marijuana legalized or marijuana not legalized, those overdose deaths are going up. Would you agree with that?
Yes, I think that what I would agree with is that the opioid overdose deaths are going up. There was a little dip, if you look at some of the data between 14-15, 15-16, but the numbers from 2017 show another increase in opioid overdose deaths. The cannabis.
Well, just for your information, we're doubling in Canada. We've doubled in 1 year, our deaths, so we're familiar with that.
And actually, cannabis use is a predictor of opioid misuse.
Where's the stat on that? Where's the science of that?
The data came from, I think it was Olson's article in the Journal of Psychiatry recently. They looked at a number of 34,000 people, and they did these studies showing that cannabis use increases the risk of non-medical prescription opioid use and opioid use disorder.
Just one last question. So there's in Livingston et al., which is a paper put out by 2017, and in Colorado they found that with legalization, that in fact there was a 6.5% reduction in overdose deaths. And this is a scientific paper versus the rest of the country, which averaged 6.5 increase, Kentucky leading them. So, we're going along with this idea of gateway drug, all the rest of it. The fact of the matter is that marijuana and opioid overdose deaths are not a connected or a relation fact.
Okay. Do you have a further comment, or?
Yeah, I think there's some weaknesses to the Livingston study from the Journal of Public Health. He looked at some of that data, but he didn't take into consideration a lot of other factors, including the increase in widespread use of Narcan, which is a reversal agent for opioid overdose. He didn't take into consideration the fact that physicians are more reluctant to prescribe, and patients, in my experience, are reluctant to receive opioid prescriptions. There was also, at the same time, rescheduling of hydrocodone from Schedule 3 to Schedule 2. So there's all other factors other than just the fact that marijuana is there, or therefore we're going to have opioid.
Oh, okay,
Senator,
we're getting into it. We're out of time. You're out of your time, and we're out of time totally for this. The statistics are mind-boggling, both sides of this issue, I must say. But let me thank Dr. Finn, and I'm sorry about your travel.